Okay, this is a follow on now from we talked about our infection control kit there in the last video where we're showing you this kit. We showed the breakdown of the kit on the table here, so we're going to go through what's called the donning procedure now. We're putting on the equipment. So Sean is here and he's going to go through the procedure step by step. Just to make sure that you can see here, we're going to adjust the camera ever so slightly. And to begin with, I suppose, as you should always try and do is wash and sanitize your hands in the first instance. So Sean is wearing a watch and he's wearing his wedding band or ring, or jewellery. Now jewellery that's easy and safe to remove it, and obviously be cautious where you position it. And remember where you put it. But if you wash and sanitize your hands, so either with soapy water or in this case he's using an alcohol rub. And the standard kind of protocol here would be to sanitize for approximately 20 seconds at least. Sean is getting in between the fingers up to the wrists, in around the thumbs, and making sure he gets in the palms of the hands and the centers of the hands as well. So once the hands are sanitized, the next piece of kit that we have in our infection control kit is the apron. Now again, this equipment takes time and sometimes it requires assistance to don it or to put it on safely and correctly. So the gown that Sean has there now, the first part is he's going to slot over his head. He's going to put the arms in left and right. The type of gown that he has little holes for the thumbs to kind of anchor the thumbs in place or to stop the gown kind of moving up along the arms. There's a strap that goes around the back, which preferably when you tie it off, you tie it maybe to the side. And again, I could assist Sean, but if I am going to enter into the 2 meter space with Sean here to assist him, what I would have to try and do is make sure that I myself would wear some face mask, PPE. So the next thing he's going to look at is the type of mask which we call an FFP2, which under the Pre-Hospital Emergency Care Council guidelines is the standard of mask that you should try and have on when you're providing first aid assistance. And again, this is all based on if you have to close in and enter a space that's closer than 2 meters. So what Sean is doing here now is he's placing the mask, he's making sure that the bit over the nose is in the right position. His hand is on the outside, and what he's going to do is trying to loop on the 2 attachments in over the ears. Now, there's different makes and brands of mask, even though they still fall into the category of FFP2. Some of them have straps that go over the head. So pretty much there, what you should try and do is the one that will go over the head and let's say lower below the ears, that will go on first, with the second one over and just above the ears. And always make sure that it's over the nose and the bridge of the nose is properly pressed in and it's in under the chin. And again, for I suppose myself and Sean, if you have a beard or whatever, you want to make sure you're making a good, as best a seal as is possible. Okay, and usually a breath in and out kind of confirms it if you can see the mask moving in and out. The next piece of equipment we have is some eye protection or full face mask in this case. So you see Sean with a sanitized hands is handling the outer part of the mask or the face shield, and he has this placed on in over his face at the moment. Again, make sure it's well fitting. And these, you know, if they're the way they're opened up at either side, it'll stop any direct droplet transmission directly into the face or particularly the eyes, nose or mouth area. And it has good clarity in it so you can see. Alternatively, he could use his glasses there or a combination of glasses and face shield if needed. The next thing we have is Sean is putting on a pair of nitrile gloves, which are the low chance of irritation to skin, you know, so he's using that type of glove. And we'd always recommend that you take your time when putting on the gloves. A lot of people are in a hurry to provide first aid assistance, but you have to think about your own personal safety, which always links back to scene safe is not just something we say. We have to enact that by taking our time to put on all our PPE. So everything you're seeing here is done in accordance with guidelines. So the gloves are on, are taking us time putting the gloves on, as we mentioned already. And as I already said, if he needs any assistance at any stage, I can assist him either by talking him through the procedures or either by assisting them maybe to tie the strap at the back or, you know, putting equipment close to him to make it easy for him. So if you can remember, the last thing that you always do is place on your gloves, and then make sure that once the gloves are fitted and on, that there is no risk of maybe fluids or anything moving up in under the glove up onto the skin. So in some cases, particularly in hospital direct care settings where you might have very close and direct contact, there might be some form of either taping up here as well with gloves on and with mask on, or else, as you can see, Sean has used the little thumb inserts there to hold the gown in place to stop it moving up along the arm. So, as we mentioned, that's putting on the equipment, or the technical kind of term that's used in healthcare is donning. Okay, so we go through straight into it now with doffing, which is taking off. So the order is kind of in reverse, but you should think about, in the first instance, the most likely point of contact with someone else will be with your hands. So in the first instance now, he's going to try and remove the gloves. Now, ideally when he removes the gloves, I'm going to hold my hand up to the screen. He's going to try and identify roughly where this, what's called the anatomical snuff box, is here, and pinch on the outside of the glove and try to draw the glove off over like that, and then close it up in his hand, as you just see Sean doing. With the other hand, he's trying to insert in underneath the glove without making contact with the outside of the skin, and then without contacting the outer part of the glove, remove the glove off. Now he's going to turn and he's going to directly place that down into the clinical waste bin that we have right beside the donning and doffing area. So the gloves are off. So the next thing now, he's going to try and remove the apron. So anything to do with the eyes or the face is kind of the last thing to go. So he's going to try and remove the apron. So there's a kind of a tear strap thing at the back there. So he's never going to handle the front of the apron. He can just separate here, pull that apart, and then what he can try and do is shake the arms out loose. And what you'll notice Sean now doing is he's going to try and fold in the apron without ever making contact on the outside of it, and he'll roll it up into such a way that it's completely folded, and then he's going to let it drop off into the bin there. Again, the proper type of bin is required, or bag I should say. The next thing he's going to go for is eye protection, where he's going to handle never directly in under the mask. It's going to be the outside only. He's standing over the bin, he's handling there, and the mask is going directly in, so there's no contact. And the mask on his face now, that was the eye protection. The mask on his face is also going to be removed like this, so he's no contact directly near the front of the face, eyes, nose or mouth. And obviously the last thing, which I know you're all thinking, is what do we do next? But the last thing you do is you wash your hands. All the items are in a clinical waste bag, and now he's going to decontaminate the hands using soap and water for 20 seconds, being as thorough here cleaning afterwards as he was beforehand. And again, these things take time. It takes time to do it right and correct, but this is the time that you should take in the interest of both ensuring that your personal safety and the safety of the person that you're looking after is always paramount. Okay.